I'm Dr. Greg Kechejian, a community general and vascular surgeon here at this hospital since 1994. We actually moved to the Milton community in 1992 after finishing a stint active duty in the Army. I was originally a student, of course, in Brockton High, class of '76, and then went to Bates College up in Lewiston, Maine. Got a bug being from a bit of a medical family to go to med school at Georgetown, finished in '84, and then did 5 years of general surgery training at a busy clinical practice in upstate New York, the Albany Medical Center. Came to Boston for a year to do a vascular fellowship at the medical center here. It's been a very welcoming community. Our children were raised in the Milton area and went to school here. They've gone through college and in grad school and beyond now, but we've become very fond of this hospital. This is the main hospital that I practice at. My father was a surgeon, and I'm the oldest of 6 brothers, so it was a very attractive option. And being involved in a big family, medicine was a natural draw. But among the many areas of medicine, I particularly thought surgery would be very supportive of inventiveness and some creativity, as well as a direct opportunity to cure. Since many areas of medicine you can't cure, you sort of control the problem. We control a lot of cancers. Once we cure them, we control blood pressure and diabetes, although we are making a lot of headway in there. But with surgery, with appendicitis and gallbladders and certain vein and vascular issues, we can actually make a real permanent, long-term improvement in their lives. And that immediate reward was very appealing to me. Almost certainly the interaction with patients, being involved with them at a very, very intimate level. You know, I can't think of any other career where you could sort of be with just a hello. Our society has given us great privilege as physicians to develop that intimacy and really help them with the education and putting their health and their procedure, if necessary, in perspective, really helping them, you know, sort of emotionally and physically through, and their families through what can be stressful times. It's very, very rewarding, as well as the technical aspects of actually doing something meaningful. It's been a wonderful balance. General surgery is the core of surgery. There's, if I had this correctly, 11 core components in general surgery. And there are subspecialties in many of those, including breast and my passion, vascular. And by nature of general surgery, you tend to gravitate to a few of these core components, but it's a broad practice and therefore very challenging, because you have to know a lot about a lot of different things. But we're not the last stop. So in our community, with a very strong BI network, we can make appropriate referrals to colleagues to care for problems that I don't care of. We can do a better job with have more resources, but we can do an awful lot of things. At least 90% of common problems can be handled well, very well, with very good outcomes, with good safety and low infection in a community setting. That's a very attractive thing about this hospital.